Hello, everyone, and welcome to episode 34 of the Pet Behavior Chat. And I'm so excited for this episode because not only do I get to chat about my favorite topic, which is veterinary behavior medicine, but I also get to chat to one of my dearest friends, Dr. Daphne Ang. So Daphne, just to give you guys a little bit of background, Daphne and I met actually in 2018, was it? Or 2019?
Yeah, 2018.
When we were both doing the distance education course through the CVE in Australia for behavior medicine. And since then, we've both embarked on residencies in veterinary behavior medicine. And Daphne actually is a practicing vet in Singapore. So it's been always really interesting to compare sort of how veterinary behavior medicine works in the slightly more remote areas of the world. So welcome, Daphne. So lovely to have you here.
Oh, I'm so happy to be here, Katrin. I'm a bit nervous, but excited at the same time.
Nothing to be nervous about.
Yeah.
It's just like any other time that we'd be chatting, so nothing to be nervous about.
Mm-hmm.
But we've got a couple of sort of special topics that we want to discuss. And the first one is, so since starting this podcast, I've had so many vets reach out to me who are also interested in perhaps going down the route of a residency in behavior medicine. And as we know, no two residencies in behavior medicine ever really look the same. And I think there's such a high degree of flexibility in them. And we just wanted to have a bit of a chat about how you've set up your residency, because you're doing it a little bit differently to how I did it, and how you've found that all to work and how you've done that.
Yeah, so very long road, a lot of work, kind of a lot of planning as well. But despite all that, I think it was worthwhile and a very good opportunity, obviously, very invaluable opportunity. So I have children, so I have kids of my own, and being away. So in the US, obviously, as you know, there's like a conforming versus a non-conforming kind of residency. So I'm doing the US American College boards of veterinary behaviors residency, and I couldn't do the conforming because it was full-time in university, and with my family back home, I just couldn't do be away from the home for 3 full years. So then there was, of course, the non-conforming, which you have to plan and meet the criteria for residency, and in some ways, just like Katrin, we had to look for a mentor. And I found that the hardest part, to actually find a mentor that will suit your timeline, but at the same time have kind of similar, I won't really say similar characters, but more like somebody that you can find that, you kind of click and that your goals or your philosophies of life, or the kind of work ethics is similar. So I think going around looking for them, there's so few of us around, right? There's so few of these specialists around. So that was I thought by far the hardest. I never knew that I could actually get into residency. So when I did the course and met you, obviously, Katrin, it was more like to explore what I could do in terms of being a better vet. For me, every time, after a few years of practice, I get a little bit jaded, and my to go to is really to find find deep inside me my love or my interest, for veterinary science in general. And so in the past, I've used to do other courses, and then I thought, and I'm going through down the list and veterinary behavior. Oh, yeah, I kind of thought about it, and I didn't realize I was kind of practicing some of the, some of it as well. And I thought, okay, I'll just go for this course. It just sounds really interesting, and in some ways, I have been always curious. How do I make my patients feel better? And also because I was a mom at that point, how I would make going to the doctors, having that clinical experience, a very much better experience for my kids. I found that was really invaluable for practitioners to always be aware and to always take in consideration what the patient is actually feeling. And I'm like, oh, this would be great if we could do that in our, with our animals, the patients and the animals we all love. And wow, there's this area of veterinary behavior that not many people talk about. So I went on and I realized that, oh my goodness, I've been surrounded by people like me. And so, and the rest was history, right? So the more I went into this, the more I wanted to know about it. Then speaking to I realized that I really wanted to learn more. So I and knocking on every door. I went for conferences first, and then I decided I will learn more from the experts. So I kind of shortlisted some people or some areas of the US that I wanted to visit. And then I started my whole journey. First, without any expectations, I just went to visit them, learned from them, saw how they saw their cases and how they work them out. And then I decided, okay, maybe I'll try. But then, of course, there's a roadblock at that point because, having to work in the US to see cases, then I would have to do the NAFLIs. So unlike you, I think I do not have many cases in Singapore. I might not have the opportunities for or access to facilities that allow me to actually, be better at this or any guidance here in Singapore. So I had to choose between being away from my family or then find someone who could actually go in between and allow me to still, train in behavior, but at the same time be able to be with my family, throughout the year. And so after many visits and speaking to many people, I finally landed a spot in Florida with Dr. Rodasta. Initially, it was with Dr. Kelly Ballantyne, but we decided that it was better to split the roles and the different sections, I guess, of residency. And so I did my clinicals with Dr. Rodasta, and that was great. But because I had to see the cases in the US, I had to do the NAFLIs. And so I had to sit on the NAFLIs, and then I got my license and was able to go on to do. So I've just finished my 18 months of clinicals. Yay! Yes. And that has been a valuable experience. I mean, the traveling was hard, obviously. So residency in itself is not a simple, not easy process. Okay, getting into residency is not easy process. I think I feel like we all have to have some level of knowledge before going in. Because just jumping into it, you might find you're either very disappointed because that was not what you expect, or like we know so little of it, and that to actually really dive deep, it takes a lot of commitment and a lot of compromise, on our part. And so I think the course, gave me some form of foundation, and then of course I went on to do other courses. So I would say this 18 months have been much of a growing time for me. So I've grown a lot through this experience, but it was not easy at all. It's been a long road, a very fulfilling, it's very satisfying in some ways, but I would say that it came a lot of compromises as well. So very different from how you did it. I basically did a non-conforming where half my time was spent in the US, traveling back and forth. And then the other times when I came back, I did some behaviors and I see cases on a request basis. You're starting to build up the service here right now. And then but I usually work full time as an emergency vet here. Wow. To pay my bills at the same time, to finance the whole emergency.
Yeah. I have to say, I've always admired your commitment such a lot, because I agree, it's been a tough road. I mean, I think any residency is not for the faint-hearted. I think any resident you speak to will say that there are challenges that are, unique to each and every program, whether you're doing anesthesia or orthopedics or dermatology or, whatever it is you do. And I guess the one really amazing thing about behavior is that there is this non-conforming option where we have the possibility, if you are, based not in the US or not in Europe, to actually get a specialist education in something. So that's something that I hugely valued. I think, like you, I found the residency difficult, but I've also really found it to be a period of growth and just almost kind of loved every second of it. Diving deep into an area that is really still quite unknown is the wrong word, but it's not as popular as the other disciplines. There aren't that many of us, like you say. And yeah, finding that right mentor, that right supervisor that clicks with you, that fits with you. I think, that's a struggle for many of us, especially in behavior, because there aren't that many supervisors out there. But yeah, I'm just so in awe of your commitment to getting it done. And I'm excited to see. So you finished your clinical cases, and that's crazy to me as well, because you saw 400 cases in 18 months or something crazy like that.
Yeah, pretty much. Yes. I work really hard though. So I think it's, I feel like it's not unattainable. It's not like, I'm sure if someone else is in my shoes, and I'm limited by, obviously, working in the US, that means I had to get a visa. So it's, and I'm limited by my visa. It is 18 months per time. Of course, I could extend it. So then, of course, being away from home and having to kind of commit to that financially as well, I had to make a point, like I had to make a commitment that every time I was there, I was going to maximize my time, right? So basically, I managed to finish it because when I go in, it's basically I'm just seeing cases. I think some residents, what they do is they kind of split it all up. So like within the week, there'll be some times where they'll be doing their study, and then sometimes where they're seeing cases. Whereas for me, because I know I'm limited by time and also by my visa, so every time I went in, it was just seeing cases. I had very little time to kind of devote like one day just to do full study, or like one day to do the research. And so therefore, I could finish in the 18 months. And also after this, I'm still in the residency, doing fulfilling my other criterias. But it's not like I would believe that if you're limited by time, you would kind of just kind of dive in. And I guess I was lucky being in a practice that had enough caseload, right? So then that wasn't really an issue. It's just whether I had time to see them, and whether I was willing to see them, right? In that sense, So I think it's more getting the right fit in terms of like what you could commit to, and then trying to find a place that will fit in, and meet all those criteria at the same time.
Yeah, for sure.
Yeah.
So what do you think you learned? What was the kind of standout learning from your 18 months of seeing clinical behavior cases? What do you think you learned over and above the cases that you had prior seen in Singapore and in other countries? What was the big learning you took away?
I feel like every dog is similar, I mean, they're similar yet different in the same way. Like I always think, the behavior issues that I see here will be far different, but it's pretty much the same in that sense that all animals around the world do suffer in some ways an underlying, emotional disorder, like the ones we see anyway. Obviously, it's kind of skewed because, we see mainly those cases, right? But like humans alike, like all of us has some kind of challenge that we all go through. And it's not just because you live in this part of the world and you have access to, say, I don't know, all kinds of resources, and therefore you wouldn't have, anxiety or aggression. The genetics might be slightly different. So instead of like, I find like sometimes when I treat dogs back in Singapore versus in the US, in terms of maybe like how they use the medications might be slightly different, but in general, like I find all dogs are similar. I see all my patients in a different light right now. So I see them as an individual. And I think that's my big takeaway. So every time I see a dog now, whether I see an emergency or just general practice, I see them all as an individual, and behavior allowed me to do that. My eyes are open. I don't see them as a medical issue anymore. They come in for like vomiting, diarrhea, I'm just going to treat that. Now I see them with open eyes to say, okay, what is actually placed in front of me, right? Not just the problem itself, but what could be driving all this, and above and beyond this, like what is their life about? Like, who is this dog, right? So I feel like through seeing all these patients that I've developed this sense of I don't know. I just, I have a sense of like, I guess I individualize my treatment a lot now. And I feel like that has made me a better practitioner. But at the same time, it's also made me more empathetic to the humans, because a lot of our patients have have humans behind them, right? If we were like not well, we could like make decisions for ourselves. But all these patients that we see, all these animals that we see, they pretty much rely on the humans to advocate for them. And you see like a great variation in terms of like, the dedication or commitment. But at the same time, the people, or like the humans who care for these animals, take a lot of burden on themselves too. And I find it so fulfilling and so rewarding that I'm not just treating the babies that they love, the animals that they love, but I'm also that extension to them, that they're not alone, and that it's a safe place, because a lot of them come like broken and they feel it's their fault. So I feel like this whole 18 months, or like this whole journey in behavior, has actually changed my life and me as a person. And I wouldn't change it, for anything else. Wow. Because, right? I'm sure you feel that too, Katrin, right? When we all I developed this. Now when I look at my dog, I don't see a dog, I see like a human face, almost like a dog human face, and I start thinking, what are they thinking? And like, why is he looking at me this way? Or like, I just think so much more now. And I guess the bond will be different, because I don't see them just as a patient with coming in with a problem, So I think my whole big takeaway was that, we do share the emotions, as we all know, but like they're so much like us, but at the same time, I think we give very little to them, but they give a lot to us. So I find it so fascinating that as you go on, and I'm sure you feel the same, that there is so much more that we don't understand, and there's so much more that I feel we need to understand. That we as a human race need to kind of understand, and there's so much more that we can actually do to make our lives and our pets' lives better. Yeah. So I don't know, kind of like got off tangent there, but it's just been such an amazing journey.
Yeah, and I agree. It's been such an amazing journey. And I agree. Sometimes you do just get so off tangent, because you do start thinking about these things really differently. And, the pets that are in front of you are no longer just a symptom or a cluster of symptoms. They're actually, like you said, individuals who are being driven by different motivations, who experience their daily lives in a certain way. And I've always said, I've been a vet for 25 years this year, actually. And I've always said that these behavior cases have been amongst the most complex cases, or have been the most complex cases that I've ever seen, because you spend so much more time with them. If you think about even just the initial consultation, you read through the questionnaire, you really kind of delve deep into what their daily lives look like. You see the videos, you meet the caregivers, you meet the whole family. You really understand their past history and the things that have happened to them throughout their lives that have brought them to this point. And it's complex. And I agree, the individualization for me has been a big thing as well. For me, it's that whole kind of the setup of, the dog plus its family, plus its environment, plus its early life history, plus its genetics, plus, all of those things make every single patient case so unique. And you also create stronger bonds, I think, with the owners, because you spend more time with them. You're let into different areas of their lives. You get to have a better understanding of the challenges that they're facing. You see their emotions around the whole topic more, I think. And I agree, it's a really fulfilling situation, and it's more fulfilling. Not that I wasn't fulfilled as a vet before, I've always have been, but it's more fulfilling than just seeing someone for 15 or 20 minutes, and you might not see them again for another year or even longer.
Right.
And it's definitely a different journey you go on in that whole kind of world of behavior. And you end up thinking much more philosophically, which is, I think, what got you onto that whole
right. Yeah. Like as I work in emergencies, sometimes it's like we think of the problem list, right? And I'm like, no, I can think of more, right? But it's whether or not we are actually addressing those problems, right? Because a lot of times we're just treating that symptom and then that's it. We think, okay, there's vomiting, we just treat the vomiting. As long as the vomiting disappears, we've done our job. But then are we really have we actually like treated the vomiting in itself, right? So it's more of that kind of helps me think and link up so much more, that there's so many much more nuances that make an individual alive and a human, or as an animal, So this has opened my eyes to not just, animals in general, but even like when I see an individual, like when I think of myself, I'm like, oh, like when I see my kids, it's totally different, right? The angle that I look at is much more different right now. Yeah. So I think it's amazing.
Yeah, I would say that's kind of a big plug for anybody who's thinking about doing veterinary behavior medicine. If you want a little bit more and you want to go deeper and see things slightly differently, veterinary behavior medicine is definitely an area that will give that to you. Yeah, for sure.
Yeah, very mind-blowing half the time. Like sometimes I'm like, wow, how did it happen? And I love it that there's so much more to learn,
Yeah. Well, and I think that's it with behavior medicine. I think we never stop learning, and I think we've only just started. It's such a young kind of area of veterinary behavior medicine, medicine. We've only just started to scratch the surface, and there's still so much more.
Exactly. Yeah.
So let's move on to chatting a little bit about what it's like to practice behavior medicine in Singapore, because I certainly know when I started my behavior service here in the UAE, I'm obviously kind of the only one doing it in this country and also in the region. There's no other veterinary behavior medicine practitioner in the Middle East. It was quite a journey. And I remember one of my supervisors, Teresa, saying to me, I said to her, oh my God, how am I ever going to find 400 cases? I have no idea how I'm going to find all these cases. And she said to me, don't worry, they'll come. And I was like, I have no idea how you're so confident in that, but okay, let's see what happens. And it's true, the cases came. It was slow in the beginning, and it took a little bit of education, not just of the pet caregivers, but also of the other vets practicing here in the region, to kind of help them understand, what I'm doing and what are the cases I can help them with and what are the problems I can help them with. And then there was a little bit of kind of pushback, I think, from maybe the caregiver base. A lot of caregivers don't really understand why on earth they should be seeing a veterinary behaviorist. Surely a trainer can fix it, or just a vet can fix it. So I'm wondering if you had similar experiences, or what it's like in Singapore to kind of launch this service over there.
Yeah, so I think I'm probably in that early stages of how you were. Obviously early, like it's in infancy here. Definitely. I think right now, even with the human side, people are kind of more aware of human mental health and emotional disorders, things like that. And they're more open to that, right? So the same way, Asian culture itself is very conservative. So we're still talking about emotional distress and all that is like taboo. Nobody wants to say that. They just feel like they're a failure in that sense, or it's not something you want to talk about, right? So in the same way, I think the whole trying to grasp the concept of emotional disorders in humans is already kind of challenging, right? Now we're talking about animals, what? There's a dog, so it should be just, I don't know. I think everybody has a different perception on what a dog should be, I guess, right? But I think they all think that, if I buy a dog, it should be a guard dog, it should be a guard dog, but they don't think of anything else. So definitely in terms of the cultural aspect of it, it has a big impact in terms of our outlook in terms of behavioral medicine. And like yourself, I do find myself, I won't really say competing, but a lot of times, because behavioral medicine wasn't really widely available for us when I was in vet school, this was we don't even do much in terms of when we were in university, right? And so a lot of people will say, what, see a vet for behavior? They're like, no, but does she understand behavior? But we do, right? All the time we see behavior. And that was actually one of the reasons why I went to behavior, because I'm a vet, but people don't seem to trust me. They think that I don't know enough, right? But in a way, they're not wrong, because, we are not really schooled in that area. But at the same time, that just made me angry. I just felt no, we should be the ones knowing it. And why do you think vets don't know, right? And so that one of my journeys of why I went to this area. But certainly, I have a lot of people who even if it was, even they referred to me, they will usually would interview me on the phone first, and they were like, oh, I just want to know what you can bring to the table, because I've been to the trainers, I've spoken with, I don't know, everyone else, and like, what else can you do, because you're a vet? And I'm like, yeah, and that's why I could do a lot more. but yes, so this perception that vets don't really know behavior, one, is something that, is really work in progress. And I think because we are not, like a lot of us, because we're not schooled in the area, is the area of the unknown. And so because it's the unknown, then you're not confident about it, and it's unknown and becomes scary, so people don't talk about it. So even within the veterinary community, people don't really talk about it, and so they kind of sweep everything under the carpet. So if a behavior case comes in, and you don't know how to treat it, they kind of ship it somewhere else, because that's not my territory, and people forget that veterinary medicine is actually an area of speciality within veterinary medicine itself, right? But I don't blame them, because not knowing enough, just, like I didn't really know enough as well. And I remember in those days, I kind of just say, I just get a trainer, and then I don't even know which trainer to go to, right? It's just Googling and finding Dr. Google. So we have that perception that vets don't really understand behavior, and it's not their realm of expertise, and so therefore you don't go to them. And then, like, medicine then doesn't mean that we're just like no drug pushers. So it's like, no, I don't want to drug my dog out. So this perception of like, if I go see a vet, no, then the end point is that my dog's just going to be a druggie and just going to be sleeping all day, drugged out, and not be a dog, right? And I know I don't want to go there. So I don't know if that's linked to the perception that we have for human medicine, human psychiatry, but certainly I think the misconception of it all, how people don't really fully grasp, because if you think about, like, a lot of people in this world on medications, and they are living normal lives, and we don't even know they're on medication. So so just trying to like go beyond that, like, break down that barriers of that taboo, because we don't talk about emotional health, and like, what, you mean my dog has a mental problem? They think in that way, but we don't talk in that way anymore. But Asia, at least in my culture, people think in that way. And or they're like, no, there has to be something else, or they feel like, because people don't talk about it, they normalize it a lot. So when there's aggression or anxiety, they just feel that's just how it is, and like some dogs like that. So then we don't do anything about it. My dog's biting. Yeah, that's just him, right? So they don't think much deeper. Again, going back to not grasping what emotional disorders are really like, and that animals can have that too. So we are in the infancy. I think there's more and more now, as the veterinary schools are actually, having fusing behavior into the curriculum. I find that these days, when I do get a referral, it's always from the younger vets. And that's really, to me, I think that's really heartwarming. And some of them will reach out to me and say, I just really want to know, how do I approach these cases? And people come to me, what do I do to help them, right? And I think I recently did a talk as well for the vets, the local vets, and apparently it was well received. But I just feel like more and more people are very intrigued by the whole idea that animals could have emotional disorders, and that we could potentially treat them, right? And that we could actually help them, because in the past people think, I'm sorry, I just can't do anything. I cannot do anything about this. It's just, I'm sorry, I cannot help you, right? And I feel like there's a lot more positiveness in this area. So I work in emergency, and I'm very lucky to be placed in a practice that is very supportive. They're very progressive and very open-minded, and I think that's really important. And because of that, with them in the background being supportive of it, I feel much more confident that firstly, I'm not alone. And, in behavior, we feel very much alone sometimes, like no one really understands us. And then now we're like, so, but with their support and with so many people encouraging me, I think that has really spurred me on. I go on to be inspired by other people who just, go on and not give up, like yourself, Katrin. And that how people are just making, big changes in the world that they live in, and I feel I have a very good feeling about Asia as well. I think more and more, and if you look in the fear-free, the area where the fear-free movement is coming so much in Asia, I have more people coming to think, talk about how they want to make their dogs feel better, or how they want to make their cats feel better. And I never heard that before. People just like, oh, that's silly. They don't talk about things like this. They only come in for like serious problems, right? But now it's really important to them that their dogs or their animals are happy. And that they actually will even broach that topic. So I find that that's very encouraging, but we're definitely still in early days. And I see like, this shift towards that, that we can actually provide better healthcare and that we can progress in that way. And that's how we progress as a society as well, right? That we don't just focus on the physical health, but we also focus on the mental health. So like holistically treating our not just the humans, but right now even the pets that they all love. So so I mean I'm still in early days in terms of setting this up, but I think having like great support from my mentors, people around me, like the college, with everyone, trying to do the breakthroughs in small in the part of the world that they're at. I think it's like the thing right now, right? That we are riding on this wave that we have never seen before. It's very encouraging, but at the same time, so much that I think behavior is so broad. There's so much more that we can go into. So now I'm still like trying. I think more education right now. My focus is really just planting the seed, really, just planting a seed, not having any pressure on myself, but also like, anybody who needs help, I'm happy to just talk about it rather than, do a full consult or anything like that. But I see very encouraging that people are starting to kind of look for that area of help.
That's amazing. And to be honest, I think I feel similarly. I agree. The last couple of years, especially since COVID, I think everybody's a lot more aware of the impact of, social connections, the importance of social connections, and what happens when, they don't go right, and that whole kind of mental and emotional ill health piece. I think people are more willing to talk more openly about it since COVID, bizarrely. I think in a weird kind of way that has helped us a little bit. But yeah, I agree. I think, here in the Middle East, we're also still very much in the infancy of what's happening in veterinary behavior medicine. But I also feel that there's, it's a positive trend for sure. And I think, if I even just think about the number of vets that are now referring to me versus a few years ago, that's really great. And for me, I don't know if it's similar in Singapore. What's been really interesting for me here in the UAE, because we have so many different nationalities that live here, there's such a big kind of disparity between how the individual nationalities feel about behavior medicine. So I've had a number of American clients or American people that have become clients that have literally contacted me because they want medication for their pet. So the medication side of things, I think, to a lot of people that have come from the US is they're a lot more open and a lot more used to kind of having that approach. And I've also had referrals from people that have moved from the US. I've had, colleagues in the college contact me to say, I've got a client, they're moving to the UAE. Are you happy to continue dispensing medication for them? And so on. So that's been interesting. And then on the other side, I would say perhaps European clients and maybe other nationalities in general, other than Americans, I would say, have been a lot more skeptical about medication. So I've had this real mix of people that have either contacted me specifically because they want medication, and then others that have been really skeptical and kind of against medication. And in a lot of cases, I haven't used medication just because the client has just dragged it that, right? So I don't know, is it the same in Singapore that you have that kind of?
It is the same. It's true. I think having been like trained in the US as well, I don't know whether it's really like tied in with like human psychiatry, because I think it's a very big thing. People talk about it openly in that side of the world, and so it's like and a lot of times these clients or these pet parents actually do joke, and they're like, oh yeah, I'm on that too, and I understand, like it's made me feel so good, and so therefore, yeah, for sure, no, I'm here for that, right? I'm just all for it. That's why I'm here. And then there will be still those individuals that kind of like have more reservations of it, but definitely, yeah, I do see that same thing. So the good thing is, I guess in Singapore is again a melting pot of cultures. At the same time, we are really like a big travel hub as well, right? So a lot of people come in and out, and they bring their pets along, and I think pet ownership has become, people, their pets are so much more valuable to them now. and I think a lot of good things or benefits from having a pet as well. So I do have people who come to me, they're just here for medications, but there are others who like, they're kind of just curious at the same time, like, oh, I don't know, I haven't heard of this before, but I just want to know what you think. And then I think the good thing is that some of the trainers or like some of the people who work in behavior, where non-veterinary related or professionals, they are maybe schooled in the US. So then, the perception is much different. So they're more open to it as well. But despite that, I feel like it's probably in tandem with the human side of things, because more and more people are now very open to it. They talk very much more openly about, emotional health and things like that. And they see that, and so sometimes it makes it easier for me to kind of explain to them when I see a patient, right? And they were like, yeah, that makes sense. But if you have no perception of it and you're kind of you don't even think of the aspect of health in general, then that's where the skepticism comes in. And that the thought of like, oh my God, it's just going to like drug my dog out and he's going to be a zombie. It's going to walk around as a zombie. But you're right. There's a small population of people who just come to me because they feel like, I just want that and that's it. But I mean, like, it's so much more. And there are some who like, I just want to hear the options and then go with that. Right. So yeah, I in all kinds of cases, I feel like there's always something that we could give. And that's why I feel that it's so special about us, Yeah. And even people who like gone through everything and there's like, they just feel lost. I just recently saw, and she's like, I don't know who to go to, She spoke with everyone and she always feels like people see her with judging eyes. Maybe not. It's just, I think internally they just have so much of that burden. And that it was just such a relief to be able to find someone to speak, right? To talk about like such things in a very safe space. And I again think back on like how that would be for a human who struggles in life and no one really understands. And then to finally find that space where you can actually talk about it without judgment. And I feel like we're in such a special place, And so I feel like a lot of times that like you say, you just go to have these connections with the clients and then we kind of grow together, especially those that if I see on long term and the pets actually improve. It's just so special because, we've seen the ups and downs and we kind of like, go in that moments where, we're just like panicking together or like we're just worried together. And then we kind of like celebrate together when there's small breakthroughs. So I do enjoy the aspect of it. I find like I love to listen to people and I love to like, kind of tease out whatever the problems are. And even if it's just a small thing, so yeah.
That's such a valuable skill, I think, for veterinary behaviorists, having that ability to actually listen. Because I think that's something that we when we're working in general practice or maybe other specialities, we do listen, but I don't think we have necessarily the time that we as veterinary behaviorists have to really sit and actually really grasp, even if the client is saying something, what do they actually mean by that? And what does that look like in their everyday life? Right. So I totally get that. And yeah, I feel the same that, developing that bond is so special. And, the most frequent thing I hear is you're our last hope. This is the last resort.
Yeah.
We've tried everything else. We don't really know where else to go. And, we've come here to listen, to what other options there might be or what you think about it. And sometimes that I find that frustrating, and sometimes I actually feel that that's a huge privilege that they they choose to finally reach out and see if there is actually something else that we can do to help. So yeah, it's a very, very special branch of behavior medicine that goes, I think, much deeper on the interpersonal connections and actually that empathy. And you're right, providing that safe place for people to actually just be able to talk without judgment, because I think sometimes, I don't know if you feel the same, but I think clients often have a gut instinct about their pet. And a lot of times they'll say to me, I know this sounds really stupid, but I think he might be anxious. And so they have that gut instinct about it, but they think if they say that out loud, everyone's going to think they're crazy for thinking that. When actually, that's probably exactly what is wrong with their pet. And so just having that thought validated, and I've had a lot of clients say that to me as well, you know, oh my God, that's valid. You've just validated what I've been thinking for the last 6 months,
right.
Actually, right? And
so that does happen.
Exactly. Being able to do that, I think, is a really special thing as well.
Yeah. Yeah. So I feel like it's such an invaluable speciality that there is, you know, so much to actually grow in, and it's just not tapped, you know. So it's and now I see, like, of course, you know, human psychiatry with so much different light as well, like the amount of work they do must have really, I mean, like, society will be different without them, you know. So
So I want to see, just in the last kind of 10, 15 minutes, if we can maybe chat a little bit about, so you have this amazing, super interesting career at the moment where you're spending half of your time working in emergency medicine and the other half kind of working in behavior medicine, which some people would think are kind of polar opposites to each other. But I wonder whether you can kind of explain a little bit about how those two areas of veterinary medicine overlap for you, and how you found that behavior medicine has actually helped you treat your emergency patients and vice versa, and a little bit how you can kind of, how you managed to bring sort of that fear-free approach into your emergency work as well, or if that's just too difficult and, you know, you find that really a difficult thing to kind of broach.
Yeah, I think, again, I do belong to a practice that is very supportive. And I think a lot of I know a lot of the vets that I work with are very progressive. So they are for this area, they're for like the fear-free and the low stress handling. So a lot of them already do it, which makes my job a little bit easier as well. But still, I mean, like, even for myself, I think it's work in progress, right? So I guess, yes, reducing fear and anxiety in during hospital stay, that's one big thing. A lot of my colleagues already practice that without thinking that they're doing behavior medicine, right? So I'm very thankful for that. I find that a lot of times where, you know, they know that they're very cognizant that the animal is like in distress, you know, whether they're vocalizing, because a lot of them, like all of us, you go to hospital, they're actually a scary place. And for them, some of these pets, it's their first time being in hospital, and then they're not well, and they're just, you know, in the cage. And so I find like a lot of vocalizations, you know, they're whining, and must be such a terrifying experience. Of course, a lot of them come with pain as well. So if you were to integrate that on how to make that, you know, the stay more comfortable, then it's addressing these issues. And we do see in emergency, we do see a lot of, you know, who kind of be so anxious outside, you know, those pugs or the bulldogs, they are so anxious outside, or like the Pomeranians, they're so anxious outside, they come in because they cannot breathe, right, because they have not just the collapsing trachea, or like, you know, whether there's, you know, voice kind of related disorders, right? But if we could alleviate those stress outside, they wouldn't even come in at that stage, right? For us to have to kind of correct, put a tracheostomy kind of thing. And so I guess because of where I am, what happens then, and because my colleagues know that I do this, I'm very, very lucky or privileged to be in that position where they actively also refer. They'll tell the owners that, hey, you know, there's this aspect of your dog's life, or, you know, of dog's health that should be addressed, because if you address this, then, you know, you might not have this problem. So like if I see cats, the ones that come in and cannot breathe, what others, generalized anxiety or like aggression as well. So like how do we deal with aggressive dogs in the hospital?
Right.
And how do you treat them after that and before coming in? So and recently I managed to get Cilio. This is not advertisement for Cilio, but I managed to get Cilio. No conflict of interest here. I'm not advertising Cilio, but we had an aggressive dog and we couldn't, you know, medicate. So then of course, then my colleagues came to me and like, what do we do? It just happened to, it was just a simple thing. I don't think I did anything special or anything, but I happened to have that and gave them the option. And because of that, dog was able to be seen and we could actually treat that dog. And I still remember in those days where, I didn't really think of behavior medicine. there were so many dogs that had their welfare or like their healthcare compromised because we just couldn't get near them, right?
Yeah.
So I think, you know, being working in this kind of practice, I see a lot more of these things and the variation of it, you know, coming in because they couldn't do anything about it because of the aggression, and now they're really sick. And then those that you know, come in like life-threatening kind of conditions that's related to stress. And I'm always having the opportunities to plant those seeds, especially if I take on those cases. I will plant those seeds to the owners and say, hey, you know, have you thought about this? I'm happy to help you if, you know, or like, oh, here's some resources that you can go to. Here's some people that you can go to get more help. This is what you can do to make your dog a little bit feel safer, and so they feel less anxious, and so that they won't be, you know, having this this time where they cannot breathe because of the anxiety and everything just kind of like hitting on them. Yeah, so I think that has been very invaluable to me, you know, having that knowledge of behavior and then being able to kind of apply when I work as an emergency vet. And I think that goes the same for all the other vets, whether in general practice or not.
Yeah, and I think that makes such a great case, really, that all vets, no matter whether they work in an emergency hospital or whether they're, you know, surgeons, or whether they're internal medicine vets, or I don't know, ophthalmologists, all vets really need to have an understanding of behavior medicine, because we encounter it on a daily basis, exactly like you say, in general practice. Those cats that come in with multiple episodes of FIC and then they're blocked and then they come to you, you know, for the emergency, or those brachycephalic dogs, that can't breathe and, you know, they're so anxious. Behavior, essentially, it's everywhere. And it's actually shocking to me that it's only now that we're starting to really integrate behavior medicine into everything else we do. And, you know, hopefully you mentioned education and the fact that we're not very well prepared for behavior at university. And it's true. I think, so I studied in Munich, and Munich is one of the few universities that actually did have a separate behavior center. But even that, though, you know, and 25 years ago, behavior medicine was very, very different to what it's like now. And hopefully that, you know, the universities will recognize that and they'll have a very strong behavior curriculum going throughout all of their courses. I think that's so important. So yeah, just a big plug for all vets need to know something about behavior. Yes. And then, of course, there need to be us who are both of us soon to be specialists, hopefully, touch wood, knock on wood.
Yeah, amazing. So much work to do.
Exactly, so much work to do. And I think that's a perfect place to finish on, just thinking about how fortunate we are, but that there is still so much work to do. But yeah, I think, as everyone could probably hear, Daphne and I can spend hours talking about this. And in fact, we did last year. We flew together. So I met Daphne at Dubai airport, and we flew to Pisa together for the European conference. And we were lucky enough to sit next to each other on the plane. Probably not very lucky for all the people around us, but I think we just talked for 6 hours nonstop.
Yes. Never enough. Especially when we don't have the access, right? Because, you know, back home in Singapore, like, there's no real person to speak with. So every time I go for a conference or meet any one of you, we just like so much to talk about. Yeah,
there's so much to talk about. But it's honestly, and I knew this was going to be one of my favorite conversations, and of course it has been. I love the kind of the way that our lives are a little bit in parallel, in that you're, you know, doing behavior medicine in Singapore, I'm doing behavior medicine here, and yet sometimes it does feel lonely, but then we always have each other to fall back on. And it's so interesting to hear about your residency journey, which, you know, again, I think is such an incredible journey and such a dedicated journey. And also really amazing to hear about how you integrate behavior medicine into your emergency work and your kind of GP work. So I think there's going to be a lot for a lot of people to take away from this conversation. So I just want to say thank you so much for taking time out of your busy day, because I know you're a busy lady with everything you have going on. So thank you for being here, and congratulations on finishing your clinical cases.
Oh yes, thank you. Big relief for me. Yeah. Thank you for having me.
Such a pleasure. Thank you for listening, everybody. And we will see you, or I will see you in episode 35, which will be next week. Bye for now.